a low DHEA might be a factor when it comes to autoimmunity. DHEA has a lot of different functions. It modulates endothelial function, reduces inflammation, can improve insulin sensitivity, help with blood flow, cellular immunity, plays a role in body composition, bone metabolism, sexual function, as well as physical strength and frailty, and provides neuroprotection. This is Dr. Eric, and in this Q&A episode, I am going to answer the question, is there a relationship between DHEA and thyroid health? In my situation, when I dealt with Graves' disease, I also had low DHEA, and I think the adrenals, the stress in adrenals were definitely a big factor in the development of my Graves' disease. When trying to improve my health, including improve my adrenals, I wanted to not only have normal cortisol levels, but normal DHEA levels as well. The lower the DHEA is, the more challenging it can be to increase it naturally. And as we get older, we naturally see it lower. It could be even more challenging when someone's in their 60s, 70s, 80s to increase that naturally. I'm not saying it's impossible, but when I dealt with Graves, I was in my late 30s. So it was easier compared to now I'm in my 50s. If I had low DHEA, it would be more difficult to increase it naturally. So DHEA, which is dehydroepiandrosterone, it's the most abundant steroid hormone in humans, and it's mostly secreted by the adrenal glands. There's also a sulfated form, which is called DHEAS, and DHEA mostly secreted by the adrenal glands, specifically in the adrenal cortex. However, smaller amounts of DHEA are secreted by the testes and ovaries. And I mentioned DHEAS, which is produced by the sulfation of DHEA, and the serum concentrations of DHEAS are 250 to 500 times higher than DHEA. And DHEA has a lot of different functions. It modulates endothelial function, reduces inflammation, can improve insulin sensitivity, help with blood flow, cellular immunity, plays a role in body composition, bone metabolism, sexual function, as well as physical strength and frailty, and provides neuroprotection. Also can improve cognitive function and memory enhancement. So I actually wrote an article back in 2014, so a long time ago, but a lot of the information, most of the information is still relevant. And I went into a little bit more detail with each of these functions, or most of these functions. I don't know if I spoke about all those functions, but if you want to know more about DHEA, more than you're going to get from this episode here, you could check out that article. I'll make sure to include that article in the show notes, a link to the article in the show notes, which you can check out by visiting savemythyroid.com. And also in the article, I do talk about the relationship between DHEA and thyroid health, but I'm going to mention that here. And I don't think there's a direct relationship between DHEA and thyroid health, but DHEA does seem to play a role in immune system modulation, also the lowering of pro-inflammatory cytokines, which you see in autoimmune thyroid conditions. And so because of this, a low DHEA might be a factor when it comes to autoimmunity. I mean, in most cases, it's probably not going to be the only factor, but in my situation, when I dealt with Graves' disease, I had low cortisol levels. My first two cortisol levels specifically were really low. And then I also had low DHEA. And I think the adrenals, the stress and adrenals were definitely a big factor in the development of my Graves' disease condition. Wasn't necessarily just the DHEA, but of course, when trying to improve my health, including improve my adrenals, I wanted to not only have normal cortisol levels, but normal DHEA levels as well. And I was able to accomplish that without taking DHEA. And so I'll talk about how to address DHEA in a minute or two, but want to briefly mention the hormone pathways that ties into DHEA. You have Pregnenolone, and Pregnenolone pretty much could go into one or two directions. It could form progesterone, and progesterone goes on to form cortisol. And there are other steps involved, but just trying to make it as simple as possible. So Pregnenolone goes down one pathway to form progesterone, which turns into cortisol. And then you have another pathway where Pregnenolone can convert to DHEA, and DHEA can convert into testosterone, which in turn can convert into estradiol. So one pathway we're looking at cortisol, the other pathway look at the sex hormones, And if someone is in a stressed out state, it will typically favor the production of cortisol. And over time, you could see cortisol also get low, which was the case with me when I dealt with Graves' disease. But the point is that many times what happens, not all the time, but a lot of times we'll see cortisol on the higher side and DHEA low. And then many times we'll see both cortisol and DHEA low. And again, that was the latter situation was what happened with me when I dealt with Graves, where both were low. And some will say, just give Pregnenolone, because Pregnenolone, like if someone has low DHEA and low cortisol, some practitioners might say, well, why don't we just give Pregnenolone, because you have Pregnenolone and it'll go down both pathways potentially. I mean, you can't force it to go down a single pathway. The body will do what the body will do, but that's the thinking behind some practitioners. Well, because potentially can go down both pathways, if you take Pregnenolone, it can increase cortisol, it can increase DHEA. And that might be true, but even if that is true, it obviously isn't addressing the cause of the problem. So if someone's dealing with chronic stress, which over time leads to the low cortisol, low DHEA. And again, it's not just emotional stressors, but physical stressors like overtraining, which also was the case when prior to my Graves' disease diagnosis, I definitely was overtraining. If I were to just take Pregnenolone back then and not do anything from a lifestyle perspective, not reduce the stop the overtraining, not block out time for stress management, then arguably I might still be taking the Pregnenolone. And so which is not something, I mean, there's a time and place for hormones. I'm definitely not against hormones, and we'll talk about DHEA in a minute, but yeah, you want to always try to address the cause of the problem. So that gets to how to increase DHEA naturally. Now, the lower the DHEA is, the more challenging it can be to increase it naturally. And as we get older, we naturally see it lower. So it could be even more challenging when someone's in their 60s, 70s, 80s to increase that naturally. I'm not saying it's impossible, but when I dealt with Graves, I was in my late 30s. And so it was easier compared to like now I'm in my 50s. If I had low DHEA, it would be more difficult to increase it naturally. Again, not to say that that you can't do it. And I still try to help my patients. Because again, even if someone has to take DHEA or any hormone, you would want them to take the least amount as possible. And so stress management is extremely important. If you could reduce the stressors or eliminate the stressors, that's great. But many times that's not possible. So when you can't eliminate the stressors or reduce the stressors, you want to improve your stress handling skills. And I always mention how you want to start out with 5 minutes per day, just get in the routine of stress handling. And the reason is because everybody can block out 5 minutes per day for stress management. And when I talk about this, I always say that, or many times I'll say, if someone can't find 5 minutes per day, then that person absolutely needs to block out time for stress management, because we're so busy and just with everything, regardless of if you're a stay-at-home mom and you have, like 7, 8 kids, again, I get it. Maybe there isn't 5 minutes if you have like really young ones, but that doesn't mean that you don't need it. I mean, that the truth is that those who can't find the time for 5-10 minutes, again, I say 5 minutes, but those who can't find the time really do need to find the time. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. Same thing with sleep. Again, in the situation with the mom, with if a mother has like really young kids, again, there's only so much you could do, and you might just have to deal with compromised adrenals for a while hopefully that's not the case, but I realize that that's the way it is. But on the other hand, if you're a workaholic and you're staying up late, trying to get your work done and just getting 4 or 5 hours sleep intentionally, I would say you might want to prioritize your health. And some people have sleep issues, not because it's intentional, but because it's physiological and they just have issues falling asleep and or staying asleep. And again, that obviously you want to try to address that. Adrenal support can help. And again, I'm not talking about DHEA yet. That'll be next. But adrenal support, like when I dealt with Graves, I didn't take any DHEA. Again, I mentioned how I didn't take any Pregnenolone either. So I had low cortisol levels. I took licorice root. Licorice root is good for extending the life of cortisol. Adaptogenic herbs. So I did take one at the time, eleuthero, also known as Siberian ginseng. It's not something I commonly give these days. That and ashwagandha are really good adaptogenic herbs. The downside is that they also can potentially stimulate the HPT axis, the hypothalamic pituitary thyroid axis, which can cause mild hyperthyroidism. And if someone has hyperthyroidism, it's temporary. Like if you stop taking it, but again, if you have mild hyperthyroidism, you probably don't want to. I mean, if you have hyperthyroidism to begin with, you probably don't want to do anything to increase it. Now, again, I did fine on the eleuthero, and a lot of people do fine even when they take things like ashwagandha, especially when it's part of a formulation and not separately. But everybody's different, and some people, even smaller amounts might cause some issues. But that also could support adrenals and help with low DHEA, adrenal glandulars as well. B vitamins, like taking a B complex, can help support adrenals. So yeah, there are a number of things you could do to support adrenals. The supplements are not a substitute for lifestyle changes. And of course, diet's important too. It goes without saying that eating healthy, whole foods, anti-inflammatory foods, very important. And then DHEA. So there is a time and place for DHEA. If someone has low DHEA and their cortisol is high, then they probably don't want to take Pregnenolone. If someone has low cortisol, low DHEA, again, I can't say, I'm just not a big fan of giving Pregnenolone. I know other practitioners will do it. I've had patients where they've worked with other practitioners and they've taken Pregnenolone. It's not that I absolutely hate Pregnenolone, but again, I'll just try to avoid even DHEA. It's not something I recommend a lot of. If someone has really low DHEA levels and a lot of symptoms, then maybe they should take some DHEA. Or if they have low DHEA and they've tried some of the things I mentioned for a few months and then they retest and DHEA is still low, then maybe they should take it. And when I recommend it, I'm usually recommending lower doses, like 5 to 10 milligrams. There are some practitioners who commonly recommend like 25 to 50 milligrams of DHEA. And again, I'm not saying there's not a time and place for that, but I like to start with a lower dose. And many times people don't need to take 25 to 50 milligrams. So that's just my approach. And so that is my answer to the question, is there a relationship between DHEA and thyroid health? As far as I know, not really a direct relationship, but you do need healthy adrenals to have healthy thyroid. So I should mention that too. Healthy adrenals have healthy thyroid. And then also I mentioned how DHEA plays a role in the immune system, health of the immune system, lowering pro-inflammatory cytokines, which is associated with autoimmune conditions, including Graves and Hashimoto's. So there is that relationship. As usual, I hope you found this Q&A episode to be super valuable, and I look forward to catching you in the next episode.